Hi, everyone. Good evening, and thank you so much for joining us. My name is Megan, and I'm the marketing director with Concierge Pediatrics. And on behalf of Concierge Pediatrics, welcome to tonight's webinar. We're excited to be led in this presentation tonight by Shari Resnick and Lindsay Rosen of Our Partners in Care, an organization that supports individuals in navigating, understanding, and optimizing their healthcare needs with a full breadth of services. Shari and Lindsay will share some expert insights, and we'll do some Q&A at the end. If you look at the bottom toolbar of your screen right now, you'll see a Q&A button where you can go ahead and ask questions throughout the webinar, and we'll do our best to address them during the Q&A portion. If you submitted in advance, we already have your question. Now, before I hand it off to Shari and Lindsay, I'd like to introduce Dr. Jonathan Jassy, the founding pediatrician and chief medical officer of Concierge Pediatrics. Dr. Jassy, will you please say a few words to this group before we get started on why we believe this discussion tonight is important?
Sure. Thank you, Megan. Thank you, everybody, for attending this tonight. I think it's a very important topic for everybody to hear. You know, the landscape of medicine has changed a lot in my almost 20-year career. And, to get a better level of care and service from a concierge perspective, there is a lot of things that some patients might not be aware about in the sense of maximizing what they can get for reimbursement, out-of-network coverage, changing their insurance plan to a higher deductible on that front, and even now with this big beautiful bill act, where you can utilize your HSA plans to get some of your membership fees covered for the year as well. So I think we're going to learn a lot of good stuff tonight. I want to thank Shari and Lindsay for doing this, and I'm going to take it away to them.
Great. Thank you so much. I am Lindsay Rosen.
And I'm Shari Resnick.
And we're really delighted to be here and wanted to thank everyone at Concierge Pediatrics for inviting us and for welcoming us into your homes this evening. We're really excited to talk about our favorite topic, which is health insurance. It is not many people's favorite topic, but we're happy to speak today about really the opportunities to maximize the health insurance benefits that you are paying so much for to get the care that you want for your family. And we think this is a great partnership that we have with Concierge Pediatrics, and really going to try and help you understand how you may be able to get some of your care that you're looking for with Concierge Pediatrics covered with the insurance you have. So just a little bit about our partner in care, and we'll talk to you a little bit more at the end about our services. We are health insurance advocates and advisors. We've been working in the healthcare space for well over 25 plus years. We customize our work directly with families to meet their needs. We are former colleagues and we live in the New Jersey area, right in the same town as the new pediatric concierge office. And we each have 3 children. So we certainly have spent a lot of time in pediatrics offices, and we have college age kids now too. So we're really excited about the services that are being brought to our community through Concierge Pediatrics. So in the webinar this evening, we're going to talk a little bit about the basics of healthcare and insurance and just how medicine has changed. The health insurance landscape changes on a daily basis, and it's important just to kind of ground ourselves in some of the core building blocks. We're going to talk about our take on how you can get your concierge coverage covered through your health insurance, some best practices we found for submitting claims and managing your health insurance, how we can specifically help, and then answer your questions. Great. So Shari's going to start us off with some basics about our healthcare and insurance.
Thanks, Lindsay. I'm just going to give you a quick overview of insurance basics. There are an array of plans, and typically they vary based on your access to providers. There are a lot of national plans that you're familiar with, names like Cigna, Aetna, UHC, and then there are marketplace plans and also sort of more local regional plans. There's AmeriHealth, there's Horizon Blue Cross Blue Shield of New Jersey. And these plans offer a lot of different products. Some are more restrictive in terms of needing referrals. And as Dr. Jassy said, been this huge upsurge in high deductible health plans, HDHPs. That's a real trend we've been seeing over the last decade. And there are some implications regarding use of HSAs that we'll get talking about. And there's also issues regarding in and out of network providers. We're seeing a lot more providers going out of network, and some plans don't offer out of network benefits, but a lot of plans do. And that's what we're going to talk about here, how to utilize your out of network benefits. And now Lindsay is going to give us a little bit and dig a little deeper into actual coverage that you have for your specific plans and the details.
Thanks. So really the key to understanding your coverage starts with your card. And so everyone, we have an example here of United Healthcare card. You can also get a lot of key information on your health plan portal. This is really a great window, as it is a portal, to really understanding your benefits. You can sometimes chat with different representatives. And if you have time and patience, you can always call your health plan to get information. But plans are often broken out by the medical benefit, a behavioral health benefit, and then the pharmacy benefit. And that's important just for how claims are managed and how you understand what coverage you actually have. For the pharmacy benefit specifically, sometimes that dictates which pharmacy you can go to. So for our local New Jersey families, sometimes you can go to Short Hills Pharmacy, sometimes you may have to go to CVS or Walgreens. It's also important to understand within your plan, sometimes you have a fixed number of visits for physical therapy, chiropractor, etc. So it's really important that you understand your plan. On the next slide, we talk about also on your card, really the core basics are the deductibles. And this is something that has really grown recently. So you sometimes have a deductible for in-network care and sometimes for out-of-network care. So of course, with Concierge Pediatrics, that would be an out-of-network service. So you would have to meet your deductible first before you actually receive any money back from your plan. And this really depends on the plan you have and the way it's structured. Sometimes it's as low as $1,000, sometimes it's as high as $10,000, but it always just really depends. Another key thing to think about is that the deductible, once you start using your services, and especially this time of year, many deductibles reset in January. So in my family, for example, we're paying out of pocket right now for all of our care until we meet that deductible. So if your family member sees a therapist, for example, it's $500 to see the therapist. Your health plan has an allowed amount, and that may be something more like $150 or $200. And then on the next slide, we talk about what you would actually be responsible. So you may be responsible for a percentage of that. So sometimes it's 60% paid by the plan, 40% paid by you. So that's your co-insurance. So once you've met your deductible, then it's really your share of what you are responsible for. In traditional plans like HMOs and some other PPOs, you may have a copay. That's typically in-network, where if you saw an in-network doctor, you would be paying $25 or a specialist $50. But the vast majority of plans now have this co-insurance. Again, this is often provided on your card. One other important thing to think about is your out-of-pocket maximum. So while we're spending a lot of money on our deductible, there is a ceiling and a safety net on the back end where once you've spent, in this case, $20,000, you will no longer be responsible for the co-insurance on the other side. So the plan will actually pay 100% of the allowable. And again, our key tip here is really understanding what your family is spending. Spend time on your portal so you can really track it and understand what it is that you and your family are utilizing.
So I'm going to talk about some other ways to cover your out-of-pocket costs. And again, this is an area where we're seeing tremendous growth. There are various ways to access HSAs and FSAs, and essentially they're savings accounts, and they have tremendous tax advantages. You probably have heard of financial planners talking about the triple tax benefit. You basically can put this money away to reduce your taxable income. It can grow tax-free, and then you can access it and take out withdrawals without paying taxes. So there's a huge upside. And there are different types. There are HSAs, and then there are also FSAs. And there are two main areas where they're different. An HSA rolls over, and so you don't lose it in a given year. You can save it year after year. FSAs are essentially use it or lose it. So it's really important that you do empty out these accounts on an annual basis. Also, in terms of portability, if you do switch employers, you can take your HSA with you wherever you want to go. Unfortunately, with an FSA, that does stay with your employer. So this is sort of an area to be mindful of and as you're doing your planning, as you're electing your benefits going forward. But again, we're seeing real significant opportunities to leverage these accounts. And we see this as an important thing to be utilizing, especially with out-of-network providers. And what can these funds be used towards? They're called qualified medical expenses, and they really can range. Typically, they're used for deductibles and copays. But in our case, we were able to use it for Invisalign therapy. Some gym memberships can be covered if they're considered medically necessary. So it really is always best to check with your HSA administrator and to do some research on that. But there are some very common qualified medical expenses that would be covered. And as Dr. Jesse was saying, there are also I also wanted to speak briefly just about HRAs, which is a very new area that we're seeing some employers offer. These are employer-funded plans. There are some more restrictions in terms of what types of medical expenses you can use them on. But if this is something that your employer offers, definitely check it out. The only caveat I would say is that you don't have access typically to an HSA if you have an HRA. And so you may want to have some more flexibility. And again, those tax benefits with the cumulative effect of the HSA. Similarly, there are employer-funded wellness plans that a lot of the families we work with tap into that they may not know about unless they do some digging that can offer some real valuable and rich resources. And similarly, care navigation and advocacy services are often provided by insurance companies and can be a real benefit. So it's important to really dig into these, into your benefits and know what you have. And again, as open enrollment creeps up, to be mindful of what you're selecting. We wanted to touch on some of these new legislative changes that are coming, that have been enacted for as of January 1st, 2026. And there are two main areas. The first is just generalized expanded access to HSAs for certain groups. Mainly that's for folks who take advantage of the Affordable Care Act. So now they qualify for HSAs. But what's really important and interesting for concierge care and for membership fees is that people now can use their HSA funds up to a certain maximum for direct primary care fees, and those do apply to membership fees. So again, this is an area that we're seeing evolving and very new and very exciting, and we're going to be watching it very closely to really be able to speak specifically about how your HSA can be applied to your direct primary care fees. But this is pretty interesting and exciting and revolutionary in terms of having avenues and roadmaps to cover membership fees. And now Lindsay's going to talk a little bit more specifically about concierge care and what that's going to look like from a reimbursement standpoint.
Thanks, Sherry. So as the landscape continues to evolve, many physicians are starting to go out of network. It's just too difficult to manage the challenges with insurance. Insurance, as we know, tries to dictate the way care is delivered, and many physicians across the board have really moved to be out of network. The advantages of concierge care, and particularly here in what Concierge Pediatrics is offering, is really this exclusive access, greater convenience. You know which doctor you're going to see. The doctor knows you. The doctor knows your family. You can get access to care when you need it. You're able to text with them. So all these incredible benefits to really have the comfort and the knowledge of having a provider who knows your family. It's also really important to think about a practice that does not have to worry about insurance in terms of, is this test, really, if you're seeing a 4-year-old and 4-year-olds should all get X number of tests, sometimes insurance won't cover it if it's an in-network practice, but Concierge Pediatrics has that freedom to practice medicine the way they want to. And I think what's also really important to note is that Concierge Pediatrics, especially by bringing us here tonight, is really willing to partner with all of you as families to help you get insurance coverage within their system. And we're going to walk you through some of the things we're able to do, but it's really incredible to be able to have access to a concierge practice, but also be able to maximize and utilize the benefits that you're paying so much for. So that's why we're really excited to be here tonight to share some of this with you.
So building on what Lindsay was saying, we wanted to try to create a schematic to show you where your benefits would lie and sort of what it touches upon in regards to concierge care. And the star represents a practice like Concierge Pediatrics. So it really sits in this area that touches upon out-of-network benefits and then also utilizing your HSA, FSA, and potentially HRA. Now, if you have a high deductible plan, you're going to be utilizing your HSA and your FSA benefits more. If you have a low deductible plan, you'll most likely reach your out-of-network deductible sooner and will be able to recoup some of the money spent on medical expenses through your out-of-network benefits. So it does depend on really the nuances of your plan, but there are many avenues to be able to still submit to your insurance company and access your health savings accounts, even while using out-of-network benefits. So we can touch on that a little bit more. So when we look at a practice like Concierge Pediatrics with the annual membership fee, there are really these sort of three areas where you can get some reimbursement. For the annual membership fee, obviously the patient pays for that out of pocket up front. But again, with some of this new legislative options, we're seeing that HSAs can be used towards the annual membership fee. And what's really great that Lindsay was mentioning is with your super bills, we're going to walk you also through the process of looking at submitting and how that process is finalized. For your wellness visits and your sick visits, you'll be receiving a super bill. And again, those are submittable against your out-of-network benefits and also your HSA and FSA. So again, although Concierge Pediatrics and practices that are out of network don't typically handle insurance, when we find that families are empowered really to use their own insurance, they can have great outcomes. We've really seen it firsthand with families recouping a lot of money from the benefits that they have by taking some of these steps to submit their super bills to maximize their HSA and FSAs. And the picture can look a lot different than in a case where you don't have any coverage for any out-of-network benefits.
And I think also it's important to note that Concierge Pediatrics is willing to build those super bills and provide that information and support to you, which is really a great benefit to you as families.
So what do these super bills look like? I mean, I'm sure most people have seen these beautiful red bills. Depending on the area the clinical area, they may look a little bit different, but this is what it will look like. And Concierge Pediatrics provides this to you. Then it's the patient's responsibility to submit it to your insurance. Lindsay has mentioned how much we love an insurance portal. All joking aside, though, we find them very powerful. And we also love that there's an electronic traceable trail in terms of from an administrative standpoint. We'll talk a little bit about some of the tips and tricks, but that for sure is one of them. Your insurance will process the claim. They usually have an allotted time within which they have to process the claim. They'll determine the allowed amount, the deductibles applied, co-insurance calculated, then payment will be issued to you once you've met your deductible. And then you can submit that EOB to your HSA or FSA to cover some of the remaining out-of-pocket costs. So that's basically the process. But I think we'd really like to share with you some of our tips and tricks that we find help expedite the whole process and really make it more user-friendly. So Lindsay's going to talk a little bit about some best practices.
Yeah, one thing just on the last slide, it's important to note that when you are using your HSA or your out-of-network benefits, they do sort of talk to each other. So let's say, again, in that model where you had a $500 therapy bill, you can get the insurance to reimburse you for a portion of it, but then your HSA could cover the balance. You can't really double dip, as it were, in both of those. So that's just an important thing to think about.
And some of your HSAs, the portals are run. So for example, on Cigna, some Cigna portals will actually allow you to access your HSA directly from the portal. And again, that just streamlines everything, but there's a whole adjudication process that happens in terms of them being able to track the claims that are paid and then what is remaining out of pocket. And so, some employers have set it up in a more streamlined way, and we're hoping to see that move in that direction moving forward with more employers.
So we'll tell you a little bit more about the work that we do with families, but we wanted to just kind of take a step back and talk about basics about submitting and managing your claims. And again, it's important to remember that the claims that you will be responsible for would be for out-of-network care, so not for your in-network. And this could be for Concierge Pediatrics or any other out-of-network provider that you are seeing. So again, you should log on to your portal. We have an example here of the UHC portal, and you can see the status of your claims. You can submit your claims that way. It really expedites the process. You can also get electronic reimbursement in some cases, and that really cuts down on the time And we'll talk a little bit more about sometimes the challenges, even just with regular postal mail is always challenging. So it's really nice to be able to send your claim in. You have a digital, receipt, if you will, to know when it went in. And then typically they're processed within 30 days. It just depends on your health plan. Once that claim is processed, you'll have an EOB, which is an explanation of benefits. Sometimes now plans are now calling it an explanation of payment, which is actually even a little bit more accurate. And then you can pull up and see really the reason codes and what was paid for each of the plans. And we had talked a little bit more earlier about your deductible, your co-insurance, the allowed amount. And so in those EOBs and EOPs, you really can see exactly what they're covering and not. And that's an important thing to be watching because sometimes, there's confusions and issues, and you can actually see the reason code why they denied a claim, and that gives you a clear scent into the next steps. One thing that we always want to make sure we mention, and I know a pediatric practice can have a range of children ages, is that you have to make sure that you have the ROI, and that is the release of information. So in some cases, even children as young as 12 or 13, their mental health information will not be available to you as a subscriber or parent on your portal without explicit permission. In addition to that, once you have children that are 18, and Sherry and I both have, 13, 14-year-olds and even older kids, once they're 18, you have to make sure that you get the permission from your children, if they're willing, to let you have their access to information. And that way you can manage the whole family. So that's a really important thing to think about, especially as your kids go to college. But even as young as 12 or 13, you need to have explicit permission. The other thing to do is if your children are willing, you can get their login. And so in some cases we have for my family, for example, I have my children's login as well. And so then I can log in as them, but you have to have permission, obviously, to do that from your children. Great. So now we're just looking back at this claim form again and just wanted to share some of the reasons why things get denied. And we know that when Concierge Pediatrics provides the bills, this doesn't happen, but many times, in bills from other offices, albeit a therapy office or an out-of-network provider, simple little things missing can really just trip up the whole system. We know AI is now involved as well in claims review too. And so the little computer can't figure out where some of this information is, and it just kicks your claim out, and it just creates a whole host of problems. So you should always make sure that it has the basic information. It needs to have the diagnosis code, a CPT code, which is what was the service that was provided. POS is the point of service, and we find this happening all the time. So sometimes it's telehealth, sometimes it's in the office. If the point of service is not listed, plans love to kick back claims for that reason. The provider information, there's a number called an NPI number, which is a provider identifying number. If that is missing, again, especially we do a lot of work in mental health, so that especially comes up there. The incorrect billing amount, sometimes erroneous dates of service are there, and often sometimes the claims need to be marked as paid. So these are just sort of things to watch out for when you're thinking about submitting your claims, because it's just better to submit it right the first time.
And similarly, there are a number of processing errors. Again, these are just sort of a list of hassles that we've seen, and unfortunately, they're fairly common. And as Lindsay mentioned, even within the last 18 months, with the growth of AI, we're seeing wholesale that claims are being denied and kicked out, whereas previously they were either hand reviewed and now they're being kicked out. And so again, if you're not checking your portal, you may not know that a claim was denied. I wanted to touch quickly on timely filing. In accordance with your plan, and again, this is a piece of information that's important to collect at the beginning of your plan year, you have a certain number of days to submit out-of-network claims. Typically, it's 180 days, but some plans have as low as 90 days. So the clock starts ticking as of your date of service. And if those claims aren't submitted, then they are unfortunately denied because they haven't been submitted within the allotted time. So it's important that you're prompt in submitting claims. Sometimes claims are duplicated, and again, they can be denied for that reason. The claim form could be incorrect. The address, again, if you're sending it in through the mail, it could be going to an erroneous address. Sort of our favorite, but also the one that gives us the most agita is lost in space. Again, with the way the world works with snail mail, we've noticed that again, when we're mailing things in because we have no other avenue, really, I would say 50% of the time the claims are received and 50% of the time they're not. So again, if you have an option to be submitting your claims electronically, there are so many reasons why we really think that that's advantageous. And in terms of turnaround and reimbursement, you will see that in a much shorter time frame. So again, it's important to check your portals, stay up to date on it, and just be mindful of all of these things. We're going to talk quickly about some of our best practices. None of this really should be surprising in terms of keeping accurate records, keeping copies. We recommend for families, if they enjoy hard copies, to print out a copy, to create sort of a file folder, keep a copy of your bills in there. You don't need to do everything piece by piece. If you sit down one time a month or twice a month and submit your claims, it's a good way to really batch them. Again, with timely filing, don't delay, and then follow the submission guidelines. And sometimes there are attachments that have to be included. More recently, we're seeing as of this year that now United Healthcare is requiring that you attach either a Venmo statement or a paid receipt. So we may see some more bookkeeping on that end. And again, we're following this stuff in real time, real closely with sort of the vast network that we have to see what kind of administrative hurdles some of these plans are putting up. And again, in terms of administrative hurdles, this is a burden for a lot of families. We have families we work with, they have sort of a doom stack of paperwork that is just sits there, and it's, as we understand, it's the last thing they want to spend their time on. But it is really important. We always believe that every claim counts. Submit your claims. You may reach your deductible sooner than you think you would. So it's really important to submit those claims. Even if you reach your deductible by, say, November, December, you still have 1 or 2 or 3 months to be getting, some money back for whatever subsequent tests, say then you have a large MRI. It really is sort of how you play out your expenses over the course of a year. But if you're intentional about it, it really can work to your advantage. And with that, we're just going to transition to a little bit about how we can help, because this truly is an administrative burden, but there are many ways even beyond that we work with families and partner with families to help them navigate the insurance landscape.
Thanks. So Sherry and I have been at this for some time now, and we partner with individuals and families to really help them deal with their insurance hurdles. And that can vary for different families. There are some families, like Sherry said, that just have a doom stack, a stack of papers that they haven't gotten through. Out of nowhere claims, lots of people seeing mental health providers in these day and age. Lots of providers are out of network, and people just don't really have the time, either because they're dealing with illness, they're dealing with their families, they're dealing with whatever else it is, to go back and actually, file these claims. So there's some people, we take their whole piece wholesale and we manage it for them. We review their claims. We interact with their insurance agency. We have HIPAA forms, we have ROI forms, so we can really advocate on your behalf. We really partner with a lot of families whose children have severe mental health challenges and are perhaps in an inpatient program, and that requires a prior authorization. That requires a lot of, going back and forth with appeals. We help write appeals. We partner with medical professionals, obviously, to get the medical records that are needed. Sometimes we're just connecting the dots. So maybe, your health insurance, you need to get an MRI, and your health insurance, it keeps denying it, and the doctor's office doesn't making the right calls. And so it's just following up and following up. So we have a lot of patience, we have a lot of tenacity, and we have a lot of really efficiencies to try and get some of this done. We work on prior authorizations and approvals as well. So that's sort of on the back end. And then proactively, we help people select their plans. So it's really important to know what your open enrollment deadlines are. These are never flexible. And so you really want to be making the best choice for your family. You want to be looking at your utilization over the year. You want to think about, do you see in network? Do you see out of network? You're prioritizing having great access to pediatrics through Concierge Pediatrics, and you can pick a plan based on your premium and your deductible that's going to meet those needs. And so we help families do this. We help them think about how to maximize their HSA. We actually even can help you look at your pharmaceutical products and think about cheaper places to get it and better ways to do it through mail order and other ways there too. A big area as it relates to pediatrics is really helping with billing. So there's a lot of times in labor and delivery that bills are really they're just wonky and they're really high and you have great insurance, but for whatever reason, the information didn't get to the right place. And so we help people look at those. If you're thinking about having a surgery and you need to make sure you get prior auth, we can help there too. So there's many, many ways that we partner with families. And then specifically, here as it relates to concierge care, we're really happy to offer assistance. So as part of our practice, we really are all about partnering with families to help them. So we do a free 20-minute consultation call, but here through this webinar tonight, we're happy to offer an opportunity to come and for a flat fee, do an assessment of your benefit and figure out how you can get maximized coverage for your concierge pediatrics or for whatever out-of-network care you have. So on the next slide, we have a Google form and some additional information that Sherry will share shortly. But we just wanted to wrap it up with some key takeaways.
So the great news is that concierge care can be covered, and there are avenues for you to get coverage for out-of-network providers in general. But it's important that you know what you have, you understand your benefits, you're a conscientious consumer. It's important to submit these super bills. It really, once you get comfortable with it, it's a process, and each time you do it, it's just easier and easier. And there's method to the madness, but track them, follow up. And again, it's really important in your open enrollment window to maximize your benefits and be really intentional. Take the time to kind of think through all of the trade-offs, like Lindsay mentioned, and really make it work for you. Because as we know, premiums are rising, healthcare costs are rising, and health insurance is there to not only for catastrophic coverage, but sort of in your day-to-day care and available to you. And we want to support families in basically getting the coverage they deserve for the care that's needed so they can focus on their health, which is what's most important. So now we're going to open it up and take some questions. I think if this is the right time for that, we are happy to answer any questions anybody may have.
Awesome. So everyone can keep using the Q&A function down there. We got some questions submitted in advance. So if you guys don't mind, I'm going to grab the wheel and pitch some questions over to you. This was loaded with great, valuable information. I understand that I believe you did really cover a lot of the questions that we got in advance. If you don't mind, I will pitch those questions to you anyway, just so we can really put a fine point on it for people who had those specific questions and maybe circle back to the answer that you had given previously. So the first one is the whole reason we're here, of course, is can any portion of the membership be reimbursed with out-of-network insurance? And I think that's going to be a good answer to give.
So I'm happy to answer that. So in terms of being reimbursed with out-of-network insurance, it would not typically in an insurance company like an Aetna, a Cigna, a United Healthcare is not available to reimburse for membership fees. However, like we were talking about, the super bills are reimbursable and insurance submittable. So that's sort of one aspect of it. So for sure, 100%, those red HCFA forms, we call them HCFA forms, but those super bills can be submitted to insurance. In terms of the model that the practice is offering, right, the membership fee, what's really exciting is with this new legislation, there again is a pathway for those membership fees to be reimbursed through an HSA. Now, not everybody has an HSA, right? So it really depends on what you have access to. So if you elect a low deductible plan, you may not have access to an HSA. But if you do, again, with this all started in January 1st. So we want to see how this rollout goes and the implementation of it. But those membership fees are now considered qualifying medical expenses. Is our understanding of the reading of the legislation. So, that is a very net positive for providing an avenue for reimbursement for the membership fees.
And I can just chime in anecdotally, of course, it's purely anecdote, but I've had conversations with a couple of our members who said they do have out-of-network insurance. I don't remember which kind, but they were getting reimbursed a portion of their membership after, not for the membership, but after their visits. And they were very pleased with what they had been getting back. So with that, I'll actually pitch this next question to you, Dr. Jassy. I know we have quite a few of our Concierge Pediatrics members attending this webinar. Can you just explain how the super bill process works at Concierge Pediatrics and what patients actually need to do to get that process started?
Yeah, sure. Yeah, it's pretty simplistic. I think either at the end of a visit or people will ask for it and we'll either print it out right then on the spot and give it to the patient, or some people will text us for it or will email us for it, and we'll get that ready and send it over to you. That's not something that we deal with the insurance companies at all. So that's not something that we're going to submit it on your behalf, but we will get you the forms that you need. Just be cognizant again of the fact that, some people want it for the whole year, and anything more than 6 months is not going to get covered. So it's almost a waste of your time at that stage of the game. And between 3 to 6 months, there's a potential chance that it may not get covered either. It really depends on your insurance company from that end. But you should find out from your insurance from the very beginning, do they accept any out-of-network coverage? Because I've had some people with various insurances like Fidelis or whatnot, and I already know that they're not going to accept any of the out-of-network coverage. So you should really just know before going through the process if your insurance even covers it.
And they would request that from our front desk. I'm not sure if you said that. Is that correct, Dr. Jassy? That's where they actually
Correct.
go to. Okay, excellent.
Yeah.
Um,
Yep.
so with that, I'll direct this question back to Shari and Lindsay. This is a particular one, but it's about AmeriHealth NJ without out-of-network coverage. Can it work? Is there an avenue that they could go down?
Well, I mean, if there's no out-of-network coverage, the question is, do they have access to an HSA? So that's really where, with those families, they may now have access to an HSA, but they need to fund that HSA, right? So an HSA is funded through your employment dollars. So paycheck. So that is something that has to be funded, but that's a great consideration,
and
right?
largely during open enrollment. So as long as you have a funded HSA, if it's AmeriHealth New Jersey and if it's an HMO, then they may or may not, or if it's through the marketplace, now they should have access to an HSA if it's a bronze or a platinum plan.
Okay, great.
And that's again new for 2026, and it's really an expansion, just to have expanded access to HSAs, and then the ability to use that money in these exact situations.
But it has to be,
Makes
you have
sense.
to put your money into the HSA.
Understood. Yeah.
Yeah.
And that's why the open enrollment, of course, is important
Exactly.
because that's where you start taking part in it. Um, Reimbursement for mental health expenses. I know you touched upon this earlier. Can you explain the mental health portion again?
Sure, I'm happy to cover that. So I think a lot of mental health providers especially have moved out of network. And so sometimes the health plans carve out your mental health, but there's definitely through your, ERISA and other patient rights, there is mental health coverage. So we really encourage people, every claim counts, file those claims. You can ask your mental health provider to provide a super bill, especially there. It's important that you have all of that critical information, the NPI number to distinguish what type of professional it is, the diagnosis code to explain what's going on, the CPT code will say what type of therapy it is. And then you can go and file those claims. Sometimes the health plans really, they either get lost or they get filed to the medical benefit rather than the behavioral health benefit. So you really have to make sure you understand your plan and how to submit the claims. But we have great success in that area. And sometimes it's just a little bit about tenacity, going back and making sure that all the information is correct. Is there anything you want
With a super bill for that too, if you're seeing a provider once a week or even twice a week, again, they'll aggregate all those visits into one bill, and then you can submit that electronically, and just input the variety of dates. And so again, there's some method to the madness in terms of streamlining the submission. So you don't need to go through each time. You can batch things. And so it's, again, it may seem like a huge hassle, but I think once you get the hang of it, a lot of times we just sort of work with families to show them the process and then they take it forward. But again, if they meet their deductibles, say by June or July, everything after that, then they're paid, a percentage of the allowable, and that does add up.
And it is important, as Dr. Jassy said, to make sure you know your dates, right? So it's generally 180 days, but sometimes it's 90 days. And there's different portals like on United, I think you have to enter all the codes directly, but like Cigna, you can just put in the PDF. Sometimes there's an app on your phone. So once you get the hang of it, it's like all your other bills. You can stack them up weekly or monthly and then run them through. But again, it is something that you have to hit your deductible and then your co-insurance. So again, if you're seeing a therapist for $500 a week, you're not going to get the $500 back, but you're going to get, it just depends on your insurance. You could get $250, $300. It really adds up. And then the balance you can apply to your HSA or FSA depending on your plan.
Okay. And then this one just came through the Q&A. When should you request and submit Superbill for a calendar year plan? I'm assuming this is a calendar year insurance plan and not a Concierge Pediatrics membership plan. So if they have a calendar year insurance plan, when should they request and submit Superbills for
They
concierge
have
care?
365 days to submit, I think is maybe what they're talking about.
So we had talked about this too, right? Because like if you were to submit a super bill today, let's say that you joined Concierge Pediatrics, you had your first wellness, your first sick visit, and you got a super bill with your deductible. If you submitted it today, it would just go towards your deductible. So, it just depends. At the same time, though, it's going to give you credit towards your deductible. So then later on in the year, you will, have the full reimbursement that you need and start to get money back from your insurance. I think there's no reason to wait. I think that life is, busy. And so it's best just to submit it when you can. So I think it's a good practice when you have the visit, request a super bill, submit it. And then eventually, especially many of us with families, the expenses add up. Unfortunately, there's always expensive things, an x-ray, a broken foot, whatever it is that you hadn't planned on. And then before you know it, you've met your deductible.
Okay. And another one that had just popped up, bear with me, I'm looking through my list and I just lost it. Okay. Can you share any information about reimbursement when using a retiree HMO through New York City? They can't choose their plan. Are you able to share any information on that?
We would have to look specifically at the plan, but typically there are just a lot of restrictions in terms of your access to your network. And so the reimbursement is low, right? And so the out-of-pocket is typically very minimal, but you're very limited to using the in-network providers. And so you don't have as much flexibility in terms of going outside of the HMO. In terms of out-of-network benefits, typically they are not part of a traditional HMO, but I don't know if this specific circumstance, if there would be reimbursement for that. We would have to take a look. Again, that's where we really do our benefit assessment. And we call and we look and we see what the actual specifics are around that retiree benefit. But traditional HMOs, by definition, are considered very rigidly networked.
Okay.
I guess in that case, likely wouldn't have an HSA. They could have an HRA or some other vehicle. It just depends.
Okay. So a few different avenues, at least they could look down.
Yeah, they could look down, and we're happy to jump on the phone. We have a Google form after that, if you want to fill out the Google form, we're happy to jump on the phone to talk to anyone for, 20 minutes and give you at least a top line and then see if there's a way we can help or give people direction on how to best, ask those questions themselves.
And we'll put that up on the screen in just 2 minutes, everybody. I have 2 more questions to get through. One just came through on the Q&A while we had been speaking. My teen in college has insurance through us as parents. This has been our main insurance for years, but now they have a college offered plan through a different carrier. It's confusing. We're not sure which is primary, how both plans end up working together for out-of-network reimbursements. How does that work? And then follow up to that question is, do I need an itemized invoice from the doctor to send with the form? Loaded.
Yeah.
Well, in terms of utilizing the university insurance, that's case by case. We just had to go through that ourselves. And so we maintained our existing insurance.
It sounds like in this case, and maybe the person, we can't see the Q&A, but if the person wants to clarify, it sounds like they took on both insurances. I'm not sure.
That's my understanding of what I'm looking at here.
So some people, in both of our cases, we have sons that are in college, and we were back and forth, and as you can imagine, we did a lot of research here, and so because both of us have out-of-network coverage, we felt comfortable sticking with our plan. We have friends that don't have out-of-network coverage. for their children. So they purchase the insurance plan through the university. In that case, there is a little bit of a primary secondary, and you really have to look into the rules of the plan to understand who's the primary and who's the secondary.
It's like it's considered coordination of benefits. So again, we would have to look at the specifics, but it's, having two insurance, I mean, obviously gives you a greater safety net. But it's from a processing standpoint. Usually I think you allocate who you would want to be primary versus secondary so that when they submit the claim initially, it goes to X insurer and then it goes to Y insurer. But I think it's typically allocated.
Right. But in that case, it's probably typically like, I think if you and your spouse have insurance, it depends on who the subscriber is. And then secondary, in that case, it may be the university as the primary. But I thought the second part of the question was about, should you get an itemized bill? And the answer is always yes. To always try and get the itemized bill, make sure it has all of the key information on it, the NPI number, the CPT codes, the diagnosis codes. And then if you're not sure, you can always submit it to both and see what happens. Sometimes the insurance one will talk to the other. We've seen that too, where if someone switches their employer, right? If you switch insurances and maybe your pediatric office sends the claim to the wrong office, that could, the coordination of benefits takes time, but always get the itemized bill.
Okay. And just to be sure, that's itemized bill along with the super bill, right? Not one or the other. It's
Right.
both together.
Right. If that is also if that's something that's available, submit that as well. I mean, the super bill, whatever has the coding on it, coding is critical. So it's really the coding that identifies the practice or physician, and then it's the coding that identifies what actually took place within that visit. And that's the CPT, the diagnosis, the ICD-9 code. Those codes will allow that claim to be processed by the insurance company. And in absence of that, it will be denied. Again, not wholesale denied, but denied requiring additional coding.
One other thing that what you said just reminded me of is we've actually seen with families, whether we have 2 kids, 3 kids, more kids, is that when you are filing the claims, you really need to make sure that it's the proper family member. So we've had families where they by accident submit a claim under their name or under their, and that can really just, again, it just clogs up the system. The insurance gets confused, they deny it. And it's just always, it seems like a simple thing, but just make sure when you're submitting it that you're actually submitting it under the individual and your family who the invoice is for.
That was a good question. As far as concierge pediatrics goes, I believe that we don't typically do the itemized because we have that information already on the super bill.
Right.
Will that still be covered for us since we kind of combine it anyway?
Yeah, because you put your HICFA, you use the HICFA form, which is that red form.
Like a more comprehensive
That's
version.
better,
Yeah, that's better. And that's
Great.
also
Okay.
what, the plans are used to reading it, like the AI, like they're used to seeing it in that manner. We find, especially in mental health, it's generally like more of like a word-based format where you have dates and stuff. But the HICFA form is there. You don't need the itemized bill as long as it itemizes what happened and the costs per each, CPT code or whatever the event is.
And just to be clear too, when you're on the portal submitting it, you'll be able to look at the HICVA form, but then the family member has to actually input the pieces of information from that. So it's really great the way that you provide it. It's very easy to read. But again, then they will have to take that information and translate that usually into, a document, to a filler, and then also upload a copy of the HICVA form.
Okay. All right. So at least for concierge members, it's fewer papers, more comprehensive information on the one we give you, which tees us up really nicely for the final question that we got, which is just a reiteration, the info that needs to be on a super bill. Could you please reiterate the most important things that need to be on there and what typically gets left off?
Yes. So I think this is the best way to see it. So the diagnosis code, the CBT code, which is if you see here down in the lower level where it's actually like what the code is for what happened in that visit, the point of service that we had mentioned before, is it office, is it telehealth? That's really important. Incorrect patient information, sometimes a nickname rather than a name, a misspelling of a name, a married name versus a original name. incorrect billing amount sometimes is there too. The dates of service, like we recently had a case where we were submitting something for it had happened in 2025, but the bill said 2024. And so it got kicked out for timely filing. And then it took a while to figure out that that's what it was. And as Sherry mentioned, they like to see that it was paid. I think they just want to make sure that you've actually paid for the services. The NPI number and the physician information is also critical, and especially for mental health, we find that that gets left off. If you have a therapist or a dietitian, they have NPI numbers as well, and that's the unique provider number that the insurer is able to really verify that this is a licensed provider. Play that.
Awesome.
Helpful.
All right. Yeah, this has been unbelievably useful. I think there's a lot to go through. So just so everyone knows who's attended, we're recording this. It's going to live on our website. So if there's anything you ever want to refer back to as far as what was discussed tonight, you can find it on our website under the events tab, and you'll see some videos. That's a great tee up for, I was going to say, could you reiterate where everyone can find your services?
Great. So there's a bunch of ways to reach out to us. So we have a website, we have an email, we do phone numbers as well. Of course, we did create a special Google form that we'll send out. If you want to fill it out, we're happy to jump on a quick call, talk a little bit about your benefits, and see if, either what you can get going on your own. If it's super complicated and you have a lot of insurance needs, we can talk to you about our services. Sherry and I have been, working together for a long time, and we really like to help families that we know we can help. So we won't take on any patients or families that we feel like we really can't help them. And so this is our passion, is making sure people are able to get the most out of their health insurance. I think it's really a tremendous value that Concierge Pediatrics has, is willing to help in this way and be able to provide families with a super bill. It's really meaningful and really allows you to get the care that you want and also utilize the money that you're already paying for. Sherry, is there anything else?
And have creative ways to work with families based on their needs, like Lindsay said, depending on sort of how much in the weeds you want to get, we can support that. But that we're also happy to really work with families in a finite amount of time, and then sort of send them on their way and do a lot of troubleshooting. So we have families we work for many years, and we do troubleshooting for them when they have issues arise. And we are creative in those ways with the families that we partner with, and we have some longstanding relationships. So,
but then we also do like a tune-up, right? If you want to come to us with your giant stack of paper and you never set up your portal and you don't know what, PPO, EPO, whatever, we set up a little benefit snapshot, we get your portal set up, and then we help you clean house and start to see the reimbursement come in. So we're really very flexible. And we're really excited to have Concierge Pediatrics in New Jersey. And I don't know if there's people joining from other parts of the tri-state area. We do have clients all over the country. And so we can work with we've worked with insurances all over.
Amazing. I'll bet those people with coming in with stacks of papers are incredibly relieved. I know I certainly would be. For everyone still on, don't leave yet. As you exit this webinar this evening, you're going to see a quick questionnaire pop up. Just a couple of quick questions. We really want to hear your feedback, continue these events, make them useful and meaningful to you. So your commentary is incredibly important for us to know how to fine tune as we go on. And that's all I have to say. Sherry, Lindsay, Dr. Jassy, any final words? Great. Easy.
thank you.
Thank you,
Thank you so
everybody,
much.
very
Have a
much.
great night.
And we'll
Thank
send the
you.
Google form along with the recording to everyone who's attended. So stay
Great.
tuned for that information.
Thank you.
Thank you.
Bye.
Thank you, everybody.